The world is still dealing with the COVID-19 pandemic, and now we're looking for answers about this sudden spread of monkeypox cases all over the world. In fact, there is a suspicion that cases of monkeypox, which means that patients who are already infected with monkeypox but are asymptomatic, could be spreading the infection. There is a question mark on whether asymptomatic patients of monkeypox are spreading the infection. That could be a possibility, and that's the reason why one has to be extremely careful. The biggest concern now is that of silent spreaders. Like I said at the outset, those who could be carrying the infection and might not even know about it. Here's what doctors advise.
What you need to understand is, with regards to the symptoms, it is very tough to differentiate the initial symptoms of the monkeypox when compared to the other viral infections, because the symptoms most normally have fever, headache, body pains, sometimes occasionally your throat, enlarged lymph nodes, and rashes over the body. And the rashes over a period of time through multiple stages gradually progress to develop into pus-filled blisters. And it is only when these tend to appear, especially over the hand, the feet, the genital regions, the anal region, and so on, that people start to begin that or assume that this is symptoms suggestive of monkeypox.
Now, there could also be the case of many of those people who know that they could be at a risk of getting monkeypox, or they could be carriers, but because of the stigma, they choose not to talk about it. As far as asymptomatic patients are concerned, they have an atypical presentation. They do not have rash. They do not have prodromal symptoms. These patients can be asymptomatic during the incubation period, which could last more than 5 days. Sometimes they may have minor symptoms, and that may actually go unnoticed. Also, there is a misconception associated with monkeypox that the key symptoms include huge blisters and lesions on your body. The strain currently circulating outside of Africa is the milder one of the two known versions. Hence, the blisters that you see in these pictures may actually not appear in patients who are suffering from monkeypox in countries like Europe and America, in India for that matter. Thereby, to presume that if you do not have these huge ugly blisters on your skin means that you cannot be a monkeypox patient is going to be very, very misleading. You may actually only have low-grade fever. Sometimes it can be high-grade fever and other symptoms that can be confused with other infections, a viral fever, for example. Hence, the importance to be conscious of your behavior and take the necessary precautions.
For more informative videos like this, keep watching India Today News Mo.